Pancreatic cancer is one of the deadliest diseases in the United States. A former E! News correspondent is raising awareness of the illness by opening up about her recent battle with it. Maria Menounos was diagnosed with pancreatic cancer while pregnant earlier this year. She underwent a successful surgery in February to remove a tumor as well as part of her pancreas and her spleen, a large fibroid, and 17 lymph nodes. Menounos says her mission now is to, quote, help people listen to their bodies. Joining us now is Dr. William Dahut. He serves as Chief Scientific Officer for the American Cancer Society. Dr. Dahut, pancreatic cancer symptoms often do not occur until the disease is advanced. Just how important is it to seek treatment early? And how exactly can patients know to do this if they aren't experiencing symptoms yet?
No, pancreatic cancer is very difficult to diagnose. And I think that's one reason why it's a very deadly cancer. Because not only is it hard to diagnose, unfortunately, it spreads very quickly. And many of the symptoms that patients have are ones that are part of one's normal life. One thing it's important to know that if you have abdominal pain that lasts more than several days, but hasn't lasted more than several weeks or even a few months, really make sure you see a physician or someone on your healthcare team. Weight loss, poor appetite, nausea and vomiting, as mentioned here in the graphic, are very important symptoms. Jaundice occurs often depending on where the pancreatic lesion is, but certainly painless jaundice or pain with jaundice, one should see care very urgently.
Dr. Pancreatic cancer is the third leading cause of cancer-related deaths and is climbing. Why is this type of cancer in particular so difficult to treat?
Well, I think lots of reasons. First of all, it's very difficult to diagnose. The symptoms are insidious and are not obvious to either the patient or the provider. The second thing is that it spreads quickly. So some cancers, like prostate cancer, stay within the prostate for years and years. Pancreatic cancer, unfortunately, spreads very quickly. Another reason is just the basic biology of the disease. Under a microscope, it looks much more like scar tissue without a lot of blood vessels. So it's much more difficult to actually get treatment to the cancer itself. And I think the final reason is that they often have a mutation called KRAS, which is very difficult to target. And so new therapies are needed to target this really very important cancer mutation.
Well, in a bit of positive news, the American Cancer Society has determined that the survival rate of pancreatic cancer is actually increasing. Why is that, doctor?
Well, I think attention. So I really want to thank, the woman you mentioned earlier on about just bringing awareness, more research dollars. We've also learned about particular kinds of cancers that are more responsive to therapies. Some people with inherited mutations, such as a BRCA mutation, other mutations like that, may have drugs that work. And there are also some mutations that are unusual in pancreatic cancer or that make it more susceptible to immunotherapy. So certain types work better. More attention and more research dollars are helping, although we have a long ways to go.
Yeah, long ways to go, but awareness is helping, hopefully, at this point. Dr. William Dahut, Dr. Dahut, thank you so much.
Thanks so much for having me on.